Empathy is about being present, making time, showing respect.
And really caring, not because it's a role or responsibility that's assigned to you, but because you genuinely want to provide good quality care.
The best way to do that is to be listening, to be thoughtful, to be respectful, to really be spending time trying to understand what our families need, what they want, what they prefer. And sometimes that means asking really difficult questions of our families, but being comfortable and brave enough to do that, because when we do, we know we can really support our families the way they deserve our support.
In 2001, our daughter passed away unexpectedly from Legionnaire's disease. The fact that she passed away very quickly, unexpectedly, in a healthcare system that was new to us, surrounded by people we didn't know, I feel like it made it a very difficult circumstance for us to deal with as a family.
We were actually living at the University of Michigan, and I remember going into Evan's room, and the nurse says, "Hey, what are you doing?" I go, "Well, I'm coming here to see my case." She says, "Well, you can't come in right now. We're doing shift change, and the hours, it was absolutely cruel."
At 2 weeks of age, we gave our son to U of M, and they gave him back for 21 wonderful years. The most difficult part, of course, having him for 21 years was that we got to the point where he was so sick that he needed a transplant. A nurse came in and said, "Russell, I don't think you're going to make it this time." And she walked out, and then a doctor came in, and he said, "Russell, I don't think you're going to make it this time." And I don't know, after about the fourth or fifth, I went outside his room and I said, "Stop it. How many times do you have to tell my son that he's going to die before he actually believes you and just gives up?"
I have a daughter. Her name was Demia Zoe Eggleston. She had a liver transplant when she was 8 months old. And then around 6 years old, she went into cardiac arrest. It was a doctor that came in that was different than the doctors I was used to. And he stood next to me and said, "You need to come to grips with the fact that she's gonna die." And I remember shrinking. That's what it felt like.
To me, some of the failures are when we try to push what we think is going to be best onto a family. And a lot of times I don't think that's malintentioned on anyone's part. It's just that no one took the time to think and listen. I think my biggest mindset and sort of framing when I go into these situations is just to think of it as if it were my own family.
I've certainly learned from families over the years that they appreciate some presence, certainly time for privacy as well, but to be available and to know that those supports are near there for them if and when they need them.
I always felt the presence of somebody nearby. So I couldn't tell you if they were standing in the doorway or where they were, but somebody, and they told us that we are right out in the hallway if you need anything. And then when I had questions or something would come up, all we had to do was call, and they would come in and sit down in front of us on our level and just talk with us and answer the questions.
When clinicians are first starting out and having early experiences and working with patients and families at the time of death, I think the number one thing for them is to not rush. Saying something like, "You can have as much time as you need," is in one way very comforting, but also can be uncertain for a family. So being able to say, some families like to stay for a few minutes, which is very normal for them, and others like to stay for a few hours, and that anything within those time frames is perfectly fine, and we're here to help support you, helps to give a little perspective to a family.
My daughter was going to be a donor. She was going to be donating her kidneys and her liver. There was one day where one of the doctors came in and he sat down with us. This was pretty early on, and he talked to us about all kinds of things for donation, all of the details and what to expect. And he must have been there for like 30, 45 minutes just talking to us, and he was relaxed, he was calm, and it was on the one hand kind of surprising, because there was part of me that was thinking, doesn't he have to go? After a few minutes, I kind of got used to it, and I realized he is just letting himself be here for us.
There was never a rush. We in essence stayed in her room as long as we wanted to. Although I would have guess that Inger wouldn't have ever been ready to leave Emily. There was a time as she had died and her body became cooler, she no longer felt like Emily. And that became clear. But if we hadn't had that time, if we had had to separate too soon, I think that would have been a huge loss.
It is very important for our providers and our care teams to listen to what families are saying. What we as providers may think is important may not be what patients and families feel is important.
Sometimes people say things and it's not intentional for them to get up under someone else's skin. I would tell them to listen and pay attention to what the family wants. Ask them, can I sit down? Ask them, can I talk to you? Instead of just assuming that the family wants to talk. And if the family does not want to talk, don't take it personal. Because sometimes they don't want to talk, you know. So I would just tell them to follow the family's lead.
The families that you're working with, they know the patient best. When you open your ears and open your heart to what the families have to say, you'll learn so much more about their child and really be able to help guide them through what's going to be a possibly challenging time for them.
I was helped by families and nurses to realize it's okay for some kids to say, it's time to stop just trying to keep people alive and to try and focus on what's really important for a child with a chronic serious illness.
Telling yourself that it's going to be easy is not true, because this is a hard thing to do, and approaching it that way and getting ready before you even walk into the room. I think it also helps to consult with other professionals before you give bad news. Talk to the chaplain, talk to the social worker, talk to the other medical team, and sort of decide what it is you're going to say beforehand so that you can do it with intention and purpose.
It's never wrong in any situation to ask for help if you feel uncomfortable or even if you just want that support to provide good quality care.
With every single experience that I've had, I learned how to take care of the next kid. There's no perfect clinical setting, but I have to be able to drive home at the end of every single night, knowing quite well that I've done all I can to ensure the best outcomes for each and every child. And I try also to project that on to the other care team members, that in itself, we actually owe these kids and their families all we've got.
I never felt like any of the staff, any of the doctors, any of the nurses were ever failing me, because they had done everything in their power the whole time to try and give her the life that we wanted to give her. Really, what was helpful to us was having the doctors and the staff walk with us through that journey of letting go.
You're not a failure, okay? You're absolutely not a failure, because I know the hours that you came in. I remember on a Sunday, like you were on leave, right? And I can still remember that Sunday you coming in, you know, to like check out the meds, but I knew you were checking out my family, you know. I just want you to know that I love you for doing that.
I think it's a plight of being a doctor is that everybody's concerned about the parents who lost the child, but you know what? This doctor just lost a child, and he's given his life for that kind of stuff, and it must greatly affect his confidence, his self-confidence, and it breaks his heart.
It can be really hard to be in a place where the stakes are so high that when you feel like you don't get it right, it can be really devastating. And it can be really hard to come back the next time and try again. So I think the first step is some self-forgiveness of just allowing yourself to be a learner in these kinds of things. None of us are perfect.
This is actually not a job. It really is a calling. And that's the way I've looked at it over the years. I've had the great experience of having families or parents and other caregivers express their appreciation. For me, though, it really is the reverse. I really feel that we are the ones that should actually express our appreciation to them for giving me the opportunity to take care of that child or their loved one. It really is my honor to do that, and a huge privilege. There's no other thing I would rather do.